Thanks everybody for joining. We'll get started now. Sorry for the short delay. One of our panelists still coming on, but we'll have him shortly. I'd like to welcome you all to this Condatis webinar with the topic Scaling Digital Trust for Healthcare. I'm Condatis CTO Chris Eckel, and today we have assembled for you a world-class panel of experts who will help us understand identity, trust, and relationships, and how trust frameworks in healthcare can help. This is part of a series of Condatis-led seminars around identity. To see any previous seminars or find out about new ones, please go to condatis.com/webinars. Let me first of all introduce the experts of today's seminar. First, let me welcome Charles Walton, a Senior Vice President responsible for digital identity at Mastercard. I'd also like to introduce Drummond Reed. His title, very apt for today's discussion, is Chief Trust Officer at Evernym. And he has been instrumental in helping us to think through human and machine elements of trust frameworks. More to that later. And we have two panelists from the healthcare sector today. One is Jim St. Clair, who is Chief Trust Officer, again, at Lumedic, a US-based health information logistics company. And we have Phil Stradling, an enterprise architect at NHSX, a strategy and standards body for the Department of Health and Social Care and NHS England here in the UK. Thanks all of you for giving up your time to help shine a light on today's topic. I want to introduce this topic first of all. Trust is this one fundamental building block of any identity system. A service or an organization needs to know who is on the other side of the line, or what's his name or another attribute of the user. Maybe even needs to know how these items are evidenced or how the user is authenticated. So how can an organization trust those zeros and ones that come across the line and know to what extent the entity sending those zeros and ones is a genuine person, a being that I can trust with data, and even more to today's topic, an entity I can share very personal data with, somebody's health data. Traditionally, we establish trust by leveraging central authorities to give us anchors we bind to. And we have this whole public-private key infrastructure that was and is being used extensively. We create private keys, we derive public keys of it, we apply it to other organizations to check us out and sign our keys. Again, those keys are then anchored on something else till we end up with a hierarchy that's founded on a few central keys that nowadays are in most computer systems and are distributed with them. So this hierarchical trust is rooted around a few organizations that prescribes and protects most of our current computer communication. And what does this trust certify? The certification authorities, as they're called, they're really attesting that Chris is Chris and he lives on an address and is born at a certain date. But this is currently done quite cumbersomely by sending in information, sending in evidence, turning up to some face-to-face appointments. Quite laborious. Laborious and again rooted on a very centralistic model of authority. The concepts of those hierarchy are still maintained in current identity providers as well. You know, they maintain keys and data for the user, and the user authenticates the identity provider, and with that authentication authorizes the identity provider to release user data to a third party. So it's really just an authorization for sharing, but very centralistic bound around the identity provider and the trust there. So the user trusting the identity provider by giving the credentials, and the identity provider trusting a relying party and having a trust relationship there. All based around this PKI, public-private key instrumentation. All on a few central keys. So that's where I want to bind up this, because that's the topic of today. You know, how do we change this model for decentralized? And we can start this, you know, we allow the users by having their own keys and are not signed by a third party. And all I'm asking the user is to share their public key in a public accessible registry. So, for example, a distributed ledger. And the other thing we're asking is we're asking the user to do this in a standardized way, following W3 DID specification standard way of publishing my key. Now, if one party wants to now speak to another party, they can start key exchange based on that public information, and they establish a one-to-one secure relationship. And then based on quite standard crypto, really, this relationship can be maintained and can also be a route to data shared and then data reshared. And centrally, it allows onward sharing of the data subject with consent of the data subject. So great system, but a great system still needs evidencing of data and the source of the evidencing, and the data that I'm sharing needs to be founded. If it's just shared by another anonymous entity, one I can validate by their keys, but how do I know they are actually the UK Passport Office or the US Social Security Administration? This is where we need a trust framework. A system that allows us to know what issues can we trust. So publicizing a key on a distributed ledger is great for establishing the connection trust, but it's not necessarily enough to trust public issues and add value to the data that we are trying to share. Few approaches. You can anchor the trust on a community, or you can anchor the trust around a commercial trust framework, and we'll hear of both those approaches today. And this is where I would like to lead over to our first guest speaker, somebody who's been thinking of this trust and governance model already a lot, and this is Drummond Reed. Thanks, Drummond, for joining today. You were instrumental in establishing Trust Over IP Foundation, and I would like to hand over to you to start explaining this trust model. Drummond, over to you.
Thanks, Chris, very much. Very happy to be here and very enthusiastic about explaining this decentralized trust model. And I have a few slides to help just visualize it. So maybe we'll go ahead and advance to, there we go. So on the next slide, Chris, what we, to summarize what the sort of arc that Chris was just going through, I call these the 3 eras of internet trust infrastructure, and the centralized PKI and then the federated PKI models, you know, do follow what Chris was talking about, where the keys are you know, centralized or in a relatively small number of servers, and this third era that we've entered now of decentralized, as Chris said, the keys are, you know, the keys are everywhere, and they're especially at the edge. Individuals now have keys in digital wallets, and this has led to the whole infrastructure that we're going to talk about here today. And I've indicated there In this era, we're going to talk about W3C standards, and then there are several organizations that have been formed, just a Decentralized Identity Foundation, and then last year the Trust OIP Foundation. So we'll quickly give you an overview of what this infrastructure looks like. We can go ahead and go to the next slide there, Chris. So the foundational standards for decentralized identity are these two. Verifiable credentials are the verified, I mean the digitally signed version of the same types of credentials, of course, that we carry to in our physical wallets to prove our identity today. Now this allows us to standardize the format, the digital signatures for doing these digitally. And then, to Chris's point, to actually support decentralized keys, what we realized about 5 years ago, we needed a new a type of identifier for being able to locate and verify those keys wherever they are on the internet, and that's called a decentralized identifier, or DID. I've been working on this spec for the last 5 years. I'm a co-editor, and I'm super pleased that it was just announced about 10 days ago. It is now in candidate recommendation at W3C, so it's quite mature. So those are the two base foundational standards. Go ahead, Chris, to what they support, what they enable is what's widely known as the trust triangle. This is a diagram from the verifiable credential specification, and it just points out, I like to point out here, all the physical credentials we use today fit this model too. They're all from an issuer, they're given to a holder to put in their wallet, and then they're presented to a verifier. With physical credentials, they're verifying the credential itself. When you want to board a plane, they'll scan, they'll do a blue light scan on your driver's license, or they'll check the validity of your passport. If we want to do this all digitally, then we need to do it with cryptography. And Chris, if you highlight the key to doing this digitally is in a decentralized manner is what's technically known as a verifiable data registry, which is typically implemented as a distributed ledger or blockchain. Doesn't have to be. There are a number of ways to do that, which means, interestingly, the centralized and federated systems can also participate in this infrastructure. But this is basically what we're enabling with verifiable credentials. So Chris, if you go to the next slide here, the question is how to scale this, and so this is another way of looking at that trust triangle. On the upper half, you see the issuer and holder and verifier, and the holder's digital wallet, where a credential would go. The bottom half of this is what we call the governance trust triangle. And this is the key to both scaling it and, as Chris said, to actually establishing the human part of trust, as in how can the verifiers for credentials know that a credential has been issued by an authorized issuer under a trust framework or governance framework. And I want to stress both of those terms are used. The term trust framework is more common within digital identity infrastructure and with policymakers. When the blockchain community became part of this, they tended to use the term governance framework. That's what they talk about with blockchains, distributed ledgers. So both terms are used. But the overall job of governance, and it can be a single document or a whole set of documents, but the point is, a governance authority will say, here are the rules and policies that we will follow in what we call a digital trust ecosystem. Now, the easiest way to illustrate this, Chris, is to show that in this, what we've got here is one of the best known trust networks in the world, the payment network today, which Mastercard is the governance authority, and you're going to hear from Charlie shortly. And that means they are authorizing the issuers of a particular credential today, and that's banks or credit unions, financial institutions issuing credit cards to the holders of that card, which they actually call cardholders. And all of us, I'm certain, on this webinar are part of that today. And what we do is take that card and we present it to a merchant to authorize a payment transaction. And again, I don't, Charlie can tell you just how large that network is today, but with that one governance framework for that network, they scale to, tens of millions of merchants and I think it's in the billions of cardholders. So we can take the same model with what we've been developing with these standards and say, oh, we can apply this to an entirely different paradigm. Go ahead, Chris. We'll look at what this might look like in healthcare, for example. And you're going to hear from another one of our panelists today, Lumedic, Jim St. Clair, their Chief Trust Officer. They're the governance authority in a consortium they're calling Lumedic Exchange. And what they're going to be doing is recognizing different issuers of verifiable credentials. And those issuers are going to be the actual providers of healthcare. And as you have a medical record of some kind, of procedure of some kind, they're going to be able to issue that as a verifiable credential to the patient as the holder of that credential. That's going to go into their digital wallet, and then when they need to go to a situation like a hospital or receive care of some kind, they're going to be able to provide in a very simple procedure, just like showing a mobile boarding pass when you're getting on a plane. They're going to be able to provide a proof of those credentials they have for their of their personal medical data. And notice they're doing all that very, very, very privately, just in those one relationships. So this basic structure for how we can standardize this infrastructure and scale it, that's why we created the Trust over IP Foundation. And go ahead, Chris, we'll look at that now. So I call this the diamond, and Trust over IP Foundation was established to say, if we can standardize the diamond and how both the technology and the trust and governance frameworks works, we're going to have globally scalable digital trust infrastructure. And what this looks like, the Trust over IP Foundation, go ahead, Chris, is what we call the Trust over IP stack. And it is a 4-layer architectural stack. But the two most defining features about it are that, first of all, it's not just a technology stack like, the TCP/IP stack that is how, enabled us to use the internet and for machines to talk to each other. It is a technology stack on the right, but it's also a governance stack. And what that emphasizes is there are governance frameworks for each of these 4 layers of the stack. Now, the other thing you can see is the bottom 2 layers are about achieving technical trust or cryptographic trust, as Chris was explaining, how you can trust the keys and the machines and the agents and wallets that are communicating. So machine-to-machine trust, but the top 2 layers are all about human trust. How do you establish it between people, between organizations, and the things that we need to trust out there? And so go ahead, Chris, and go forward. We'll expand this up so you can see a little bit closer detail, the full 4 layers. That bottom layer is the verifiable data registries we talked about, so we can have that decentralized PKI. The second layer is standardized digital wallets and digital agents, whether they're at the edge of the network on our mobile phones and devices or they're in the cloud. And then the third layer is the trust triangle for the exchange of verifiable credentials, defining who issues what credentials where. The top layer is what all of this supports, digital trust ecosystems. And our webinar here today is to talk about healthcare as, not just one, but potentially, hundreds of interoperable digital trust ecosystems for the different healthcare systems around the world, one of which you're going to hear about from Jim. So that's how we are standardizing this. And you see the whole left side there is governance frameworks designed specifically to govern what needs to be trusted at each of these 4 layers. And the top layer, we call them ecosystem governance frameworks. Jim St. Clair is going to talk about what they've developed at Lumedic Exchange for that whole ecosystem. I hope that's helpful, Chris.
Oh, thanks, Drummond. Extremely helpful, and thanks for shining the light on this whole framework. That's what's needed. We can't just rely on keys by itself. Tech is nice, but we need some human element. So thanks for highlighting that. And we now have on the call Jim and Phil. I hope you both managed to join. Great to have you. And hi, Jim. Hi, Phil. And really what we wanted to see here now is from two different localizations in the world, UK and US, both quite important healthcare networks, both different in how they are and how they operate. It would be great to hear your experience, Jim, in building that framework, yes, angle, and maybe Phil, you can also give us some UK examples of trust frameworks that are needed in healthcare.
Sure.
Jim, do you want to get started?
I'd be happy to. Thank you, and thank you, Drummond, for the preceding overview and introduction. I'd go back and recap for 30 seconds an important point that I think you mentioned, Chris, which is the role of the Chief Trust Officer, something obviously Drummond and I are representing for our respective organizations. And I would offer that as businesses have evolved, we've all gotten used to the title of Chief Executive Officer or Chief Information Officer, that the Chief Trust Officer is now the role that recognizes the importance of the very digital trust framework that Drummond elaborated on so eloquently, and that the concepts of how trust is shared amongst participants in an organization or within an ecosystem, he described it, just highlight how digital trust is a foundation for data and information sharing for so many organizations going forward, especially in healthcare, as I'm sure Phil can attest from the NHS perspective, as well as from ourselves in the US.
Sure.
And it's great to be able to spend a few minutes talking about it from the US perspective. Within Lumedic, we have built an architecture supporting Providence Health Systems, which is the 9th largest healthcare system in the US, leveraging that trust framework that Drummond described in his overview. The idea being that we are in what we consider to be the era of the patient in the 21st century, specifically in the US and with the passing of the 21st Century Cures Act. With that in mind, patients now have not only, of course, the existing ethical rights, but the legal and regulatory frameworks to ensure that they get access to their healthcare data as it's traditionally been held and managed and transmitted within various healthcare organizations. And now that is something that patients are empowered to be able to get access to themselves wherever it resides. And along with that, hand in hand should be an appropriate trust framework, as Drummond described, where patients establish their trust with a healthcare organization that obviously grants them access to their information, and at the same time that the holders of their information have to demonstrate digital trust as well. And most importantly, to move away from the traditional hierarchical and centralized models of healthcare data ownership, where all of my information is an electronic healthcare record system someplace, and I am somehow granted access into it to peek in and see what I have, but instead take what we call a patient-centric perspective on information management, understanding where that data is, ultimately extending consent to that data, and managing how that data moves between organizations. Certainly in the US, this is very important because we have distributed systems of providers in different geographic locations and different organizations, and the ability to share that information between them in order to maintain a continuum of care can be very challenging. So putting the patient at the center of that information exchange is the right organizational and ethical approach to take. I'd like to pause for a minute because I know Phil is on and he has some great perspectives from the NHSX perspective, and would like his commentary too.
Thanks, Jim. Jim, can you hear me?
Loud and clear, sir.
Good. Yeah, so building on that patient-centric view, I thought it'd be helpful to describe the National Health Service, although it's well known as a National Health Service, that it actually consists of several hundred employers.
Phil, I think we may have lost you there for a minute, my friend.
Yeah, I was just wondering, can you hear me again now?
Now we can hear you, yes, sir.
Yeah, I was just trying to do the segue from your patient-centric view to looking at the National Health Service through a staff-centric view. And I think one of the key things to highlight with the National Health Service is that, as you said, Jim, in the US, there's many healthcare providers, well, as there are across the UK geographically. We've got hundreds of employers acting as healthcare providers. And one of the key challenges we've got, looking at it through a staff lens, is that we have to onboard tens of thousands of doctors and nurses to be trained every year from medical schools. And then we need to rotate them around multiple healthcare providers in different geographies in order to continue that training and development of their skills and competencies. That's crucial so that they get a good experience in different care settings, but also crucial regarding their professional status so they can maintain their license to practice. So one of the key things for scaling trust in the NHS is looking across the employers, but also the regulatory bodies. So the likes of the General Medical Council and the Nursing and Midwifery Council. They are all instrumental in licensing healthcare professionals so that they can practice in healthcare providers. And so what we're looking at is, given the high volume of staff movements for training, operational and just natural career development purposes, we have hundreds of thousands of staff movements. Every movement needs the checking of their credentials. So we're looking at the verifiable credentials model and the stack that the different layers of the stack that Drummond outlined. Can I just check you can hear me still?
Loud and clear, sir. Yeah, and a great overview from the physician credentialing side as well.
Yeah, so I'm just trying to give that sense of, you can come out of a medical school, that could be the first credential you have a particular medical degree, you join the NHS on a training program, and then we're going to rotate you around. You're going to register with the relevant professional body. These professional bodies are regulated by Parliament. The medical schools are regulated separately. So, you know, we've got the education sector, we've got the health sector, and our doctors and nurses increasingly move around, as I say, whether it's for training or operational purposes, into the public sector healthcare providers, but also we've got significant military and private healthcare providers. The staff need to work across all those care settings. And from a UK perspective, we have a lot of doctors and nurses coming in from abroad, and our doctors and nurses go and work abroad. So crucially, it's working across the whole of government. The other government departments are very important for the success and the improvements we want to bring about to support a better experience for staff, as well as more streamlined employment processes. So we need to work with what we call our Home Office around right to work visas. We have to work with the disclosure barring service to make sure the doctor is safe and is not on a criminal register. We're interested in their core digital identity, and then wanting to bind the digital identity to that individual person and to all the different credentials that they'll get, whether it's from the medical school or from the General Medical Council, or as they work in each individual healthcare provider, whether it's for a 12-hour shift or a 12-month contract. We want to build up their profile, their scope of practice, as they call it in professional terms, because they need that for their own development purposes, for their own professional status, for revalidation of their status, and to demonstrate the build-up of skills and competencies. So whether you look at it from employment or personal career development or professional license to practice, scaling this trust across the whole of government, across multiple sectors, is crucial to giving staff and the NHS a better way of making best use of its key skills, its healthcare professionals.
Excellent. I think that's great, and I would use your outstanding overview of the physician credentialing ecosystem and paradigm, along with what I described from the U.S. patient perspective, to again plug what Drummond mentioned earlier about our efforts to Lumedic with what we call the Lumedic Exchange, which is a voluntary group of stakeholders that includes participation from healthcare organizations, our healthcare payers, physician representatives, and Mastercard as outstanding contributors from the identity side, to examine ecosystems and ecosystem governance frameworks involving verifiable credentials. And while some of our emphasis is, of course, on the patient side first, in other words, how do I use these verifiable credentials for patient engagement and patient encounters? As you described, Phil, it certainly fits very well, whether in the UK or the US, around physician credentialing. And we've had some initial discussions that highlight many of the challenges you pointed out, where the evolution of verifiable credentials supporting physicians, and physicians being able to practice at one facility and in one state in the US, or obviously coming from one medical school, just as you highlighted from the NHS perspective, and how does that transfer someplace else, and what is a foundation of trust in an ecosystem between participants that can serve to streamline that and recognize trust from a credential standpoint.
Yeah, and I think we previously touched on some of the data standards can be common as well, that the sort of areas you're exploring around, say, the open badges specification for skills and competencies. That's as relevant in the US as it could potentially be for the UK. Equally, we've got FHIR profiles for the clinical data. That can be common to both staff, as we need to know staff are safe with respect to occupational health checks, as it is to a patient, that they are safely, as for particularly for new babies, we want to make sure we've got healthy new babies, that they're properly assessed, and when I say assessed, measured, weighed and measured, and vaccinated. So there are common requirements across key cohorts for patients as well as for staff.
Yeah, absolutely. And I know that the UK, as well as US, of course, are extensive contributors to HL7 International and ISO and other standards bodies around digital healthcare and digital health information. And complementary to that is this concept of how do we then associate digital trust with that information, where we're trying to improve and streamline how that information is collected and analyzed or available for transmission or sharing between organizations, and associate a standardized credential and digital framework with it, or digital trust framework, excuse me.
Yeah, it's exactly. It's lovely to have this sort of common language and models for sharing the data in a verifiable manner.
Yeah.
Jim, Phil, this is a lovely topic that you're reaching there, and I love how you bring those two sides to the coin, which are really complementary. If I think back into patient records in the early days, it was a doctor's name on the record. So how do you actually verify that? And we're coming back to that key topic. And you're bringing in a verifiable credential for any healthcare professional in the UK. That would mean, it doesn't mean, you said there's hundreds of employers. It doesn't mean we need to know each employer. They can just bring a trusted physician credential with them, and they then can sign those, Jim, your patient records that you have. How do I know which doctor signed it? Actually, now we know. What a brilliant thing, how it all can work together when we get that live. So great your discourse there.
Yeah, I was going to say relevant to say clinical audit. So if we've got professionals that are allowed to prescribe medicines, then we need to know at every time there is a prescription which doctor did the prescribing. So again, from a clinical audit to employment check audits, you can start to see the value.
Well, Thanks a lot, and thanks for sharing that trust framework approaches and puzzle pieces that can come together. You know, this is where the commercial opportunities arise also, and that's Jim, you mentioned Mastercard. Charlie, I'd like to welcome you to the topic here. How does Mastercard and your organization help the commercial part of that scaling model?
So, Chris, thank you very much, and it's really glad to be speaking again to you and Candatis, who have been a great partner with Mastercard over the years. Number one, for those in the audience, and Chris, I will come to this question, but as a quick intro, I'm part of a group within Mastercard called CNI, Cyber and Intelligence. This is the part of Mastercard where our security products and services are built for both our network and for customers and partners. I had catalyzed a new business at Mastercard in the area of digital identity, an area that Mastercard looks at with great importance. For those on the line, you might read further about that at our microsite called idservice.com, and there's information about both what we're doing and all. So that by way of a quick introduction. I suppose as Drummond had mentioned, probably not a great deal to say further about Mastercard. I think everyone is probably aware, as Drummond mentioned, the tens of millions of merchants. In fact, within the Mastercard network, there are 50 million merchants, so 50 million wonderful customers that exist in a bit north of 200 countries and territories, right? Really global in nature. 25,000 plus partners, issuers, bank card issuers who are our partners. As everyone knows, Mastercard doesn't issue credit cards or debit cards. We're a network, a partner organization, and it is our partner banks, HSBC and Citibank and Commonwealth Bank in Australia. We service the financial needs of more than 2.5 billion consumers around the planet, and at 7.5 billion people around the planet has really been a big driving point from our current chairman, past CEO Ajay Banga, who really begins to see the importance of bringing not only payments for financial inclusion, but identity, which is really causal in a lot of financial inclusion cases, to bear. Mastercard's been doing that in a growing way over 50 years, in a very large global network, and associated with that, as Drummond described, we probably hadn't called it the trust framework way back when, but really the set of operating rules that have developed and evolved that are both sensitive to local matters, local regulations, local government needs, but that stitch this all together on a global basis. So that by way of quick intro, as Chris had asked, I wanted to perhaps use example to bring forth this topic of scaling and to take the model that Drummond had talked to and perhaps breathe life into it in terms of how we see this coming about. And in this picture, I'm using the example of a very relevant current topic, which is the idea of using these sorts of technologies and using the idea of a trust framework to bring together the three elements: the issuer, that is the organization in a digital health pass scenario that issues a test result or issues a vaccine credential. This could be a Collinson group doing a test at an airport. It could be a provider of a vaccination record. near where I live at the Massachusetts General Hospital near Boston. So really to issue those credentials, authorities that issue, which is one of the roles and functions as Drummond described. In a health pass scenario, then the traveler who's actually holding that health pass that has a health credential bound to that person, and then in a wallet, and then thirdly the verifier, the airline or the airport or the border authority that wants to confirm that it's really Charlie or Charlie's health credential, and it's Charlie presenting it there. It's not our friend Chris pretending to be Charlie and trying to get into Singapore, but that I'm really bringing my health pass credential on my mobile device, and this would be in fact the way in which we might depict such a system. We'll call it the triangle. But as Drummond also pointed out in his earlier brief, and Chris, if you could advance to the next and really show a bit of the animation, really this idea of a commercial SSI network of really bringing to bear commercials and governance of becoming in some sense the orchestrator, not the single point of failure and not the know-all be-all pool of identity data, but the orchestra conductor to in essence bring some commercial sensibility to bear. Really, the scaling of SSI we do begin to see as becoming very, very critical here. This movement of the triangle to the diamond, and we think the diamond is where we will end up finding SSI and decentralized begin to sing. So what do we really mean by that? The first is a set of what I'll call RegTech-like functions, the rules, the operating rules, the trust framework, the accreditation of participants, the continued compliance, the audit, the mechanism of dealing with disputes. Because as we all might know, things tend to go wrong even in very well-designed systems. Occasionally in a payment network, you do see a chargeback to say that, gee, Chris is claiming he didn't buy that new widescreen TV, and he's got a dispute with the merchant or a dispute with the bank. And you do also have circumstances where other fraudulent activity can begin to occur. So a series of RegTech functions, that's number one. The second is really market making, of developing the acceptance, the economics, the incentivization to kind of get off the ground, really the drive to adoption. The notion, if we were to think about it, of in an education space, why the university should in fact publish their university credentials, in a manner to operate in a broad-based network. So really making market, and then thirdly, a series of value-added services. In this particular example, at the end of the day, what Singapore Air wants to do when Chris is flying from London into Changi is to confirm that he's okay to enter the country, consistent with the rules that the government of Singapore has established. At that point, and with that check, they don't actually need to know that he's in fact had the Pfizer vaccine or what his age is or anything else, but he needs to be consistent with the rules. And the rule set may say that you need to have a current vaccination and you need to have a test that's been conducted within a period of time, as we're still learning more about vaccines and effectivity. And so this idea of a complex claim of Chris communicating that it is Chris, and here's my vaccine credential and here's my test credential, bound together, a complex claim. And so in that context, a way of adding value of issuance and providing perhaps additional assurance. I've also checked his identity, and I've checked both his identity from the perspective of a passport, and I've confirmed an entry visa as well. In order for systems like this as well to work, we need to confirm, in fact, that Massachusetts General Hospital is the issuer of Charlie's vaccine credential, and Massachusetts General Hospital is an appropriate organization to issue vaccine credentials. Unfortunately, Drummond's Vaccine Shop is not yet qualified and is not an appropriate organization that the Singaporean government should honor or in fact reflect or accept. Now, the problem is that Singaporean government doesn't know the difference, frankly, between Drummond's Vaccine Shop and Mass General Hospital. So in essence, this notion of kind of onboarding an issuer is really quite key. Onboarding issuers as well is important, as is onboarding and creating registry for verifiers. So you think about this, the verifier in a community like globally interoperable health pass. Think about this: 200 countries, each with a couple of airports, in some cases lots of airports, flying international flights like crazy around the planet, and with quite a few airlines. We'll call it 50 really big ones, but a lot of airlines, and with rules that are changing on a weekly basis, okay, on what it takes to enter. And you can get to the view of what Verifier Registry is all about, the set of rules that the government of Singapore sets for entry that a pre-departure control system platform or an airline or an airport might need to implement, okay? And so that type of function, if you think about it, the triangle doesn't solve it, the diamond does. And then lastly, as much as all of us, right, all of us see the importance, the vision, the view, the criticality of this type of decentralized system and architecture, the world is what it is today. And we don't have Mass General Hospital, in fact, issuing W3C compliant verifiable credentials. So I guarantee you, in the month of March 2021, they do not issue credentials in that form. And so in any sort of big technology movement, and I would have to say this is probably one of the real big ones, you end up having this notion of tech migration, evolution, and qualification translation that will begin to occur in time. So I'd say, Chris, I wanted to, and I know perhaps quite long-winded, I've tried to explain what I think become important in this movement of our industry to commercial and commercial scale, and these are the sorts of functions that I see appropriate there. So hopefully I've addressed that, and certainly would be glad to take some questions as we go. If we could advance, Chris, to the next slide. Just a bit of an update for the audience about some work that a number of us on the call today have been involved in, and that's called the Good Health Pass Collaborative. And it's very much first off a nonprofit project that's been catalyzed by the U.S. organization, the nonprofit named ID 2020, to really bring together health, identity, technology, airline travel, and government stakeholders to kind of align on a framework of standards for how interoperable digital health passes will work at the acceptance end. So how does Singapore Airlines, who flies every flight internationally and has to accept multiple health pass implementations, how will they do that in a standard way? Well, first off, it's very critical that you get on board to decentralized SSI techniques as Drummond has described. That number one, and to do that in a manner where the aspects of these domains are really brought together and described. We need to see the vision of that, and that's what this group was formed to do. A near-term mission to publish a blueprint, which will be done in the next several months, to describe how the aspects of interoperability will come together, how vaccine schemas, how lab registries, how identity binding, how trust framework will work within an integral whole. So I thought it was helpful to Chris to communicate to the audience that that this work is going on. It is quite open, and we'd encourage other organizations that may be on that are unaware of it to find out more. info@goodhealthpass.org, to talk to any of us. Jim's been in fact quite involved, so is Drummond and myself, if you'd like to learn more. I see this as probably one of the lead ponies in a pretty massive digital trust infrastructure that does involve healthcare, and I think quite relevant to the topic today, Chris. So I'll turn things back to you. Thank you.
Thanks, Charlie. Yeah, thanks for shining this commercial light and shining what Drummond had in this diamond, that commercial body or the trust framework orchestrator. You know, you were talking of onboarding issuers and verifiers, and you know how much more than the payment network where you're onboarding banks to be issuer. You have that experience conceptually, at least. So great lead over from payment to identity and onboarding identity issuers into a trust framework. So that's great. And Drummond, I'll come to the workshop tomorrow. Is that okay?
Have we got one for you?
Yeah. So a few questions that are there just before we finish up. One question from the audience is there danger that the global requirements and the complexity are a risk to successful change?
But maybe Chris, I'll start, and then if Phil or Jim or Drummond have answers, you know, I'd say with respect to this overall field, absolutely, there's danger of that, right? I mean, it's very important to in fact consider whether you're boiling the ocean or making a big disruptive movement, right? And this sort of stuff has got that risk, and it's also why proactive and pragmatic leaders driving this out and having that conviction behind it, by being open and standard oriented, by being transparent, are all really important. And so these notions of proactive and dedicated, I look at the work that Jim and the team at Lumedic are doing in the Lumedic Exchange Network, and you know they've got you know, clearly the backing of Providence Healthcare, one of the major systems within the U.S. market, and I think some of the work going on right now within the Good Health Pass Collaborative, which is really aimed at being inclusive and very open, you know, within the community. More than 80 organizations have endorsed what's going on. So listen, at the end of the day, Chris, with anything like this, we could all drink our own Kool-Aid and get awful excited about stuff that's not there. But boy, I think there's a real groundswell these days, and amazingly, a field as health, where you do need such digital trust, but has been a field that I'd say probably has lagged a little bit in the informatics versus say financial services. I think it's just coming up real strong, and it's one of those areas. When you do think about it, right? Drummond described this idea of becoming very person-centric, and you look at the regs in the U.S. like HIPAA, where really the user's at kind of a control point. I'm the one that decides whether you know, I'm going to pass my healthcare record and you know, my knee surgery X-ray to Drummond or not. I mean, that's up to me. But have Drummond try to get that from Mass General Hospital. It's almost a, you know, an act of God these days. So I think this provides some really wonderful benefits to many healthcare systems. I think it's incredibly important. So I tend to judge it to be the start of a very, very, very big movement that's showing great signs of becoming reality quite near term.
Yeah, and I would just add to Charlie's comments. I thought he gave a great overview, and I'd add 30 seconds more. That you know, the changes and transformation are oftentimes hindered because of these concerns about risk and complexity, and that's all legitimate. But as I understand it, there's a colleague of mine from UiPath that may be on, and I used to be a UiPath partner. So in robotic process automation, one of the first things we used to take a look at is what was the complexity of your processes? Do you have too much complexity in your processes? And does that complexity exist because you're trying to protect your rice bowl, or because that's just the way we've always done it? And in adopting a new paradigm, be it process automation, digital trust, verifiable credentials, are there new ways that the parties in the ecosystem can agree to new and simplified ways to do things that reduce that complexity, reduce the risk, improve the transparency, and improve the adoption of that capability overall?
Thanks, Jim. And Phil, if you're there, I'm thinking back at the time when we were discussing around health data, and there was always this, the governance guys are the hinderer of the movement of data, and all of a sudden we are putting the health data to the user, something you've envisioned for a long time.
Yes, a couple of comments on that. Yes, there is that historical perception, but I think it's worth calling out to build on the input that the already made around how do we address this risk of the complexity. There is recognition in the UK as well as at the international level of the value of the diamond, as we heard from Charlie. So within the UK, there's work to establish on a formal legal footing a trust framework for digital identities that will then facilitate the sharing of attributes as claims as credentials. And that chimes with other work elsewhere. Open Identity Exchange is one such body, but more recently the World Health Organization at the international level is exploring a trust framework. And so here are some initiatives where UK government and international bodies like World Health are starting to put some useful initiatives in place to overcome the risk and the complexity. And so I think that's worth calling out. It's a journey, but at least the intent is there, and it's very much not so much from the UK perspective that government is going to be the controlling thing. It wants to be the enabling thing. So whether it's Mastercard or other initiatives, whether it's private sector, charitable sector, or whatever it is, they can flourish doing what they're good at doing to support the different needs in the different sectors. So I just wanted to sort of highlight that it's a move on from where we were a few years back, Chris.
Thanks, Phil. And it's fantastic, Drummond, how every of the speakers picked up your diamond now. So back to the diamond, you mentioned on the chat the commercial SSI model. So how can this diamond bring us back to the diamond and the Trust over IP Foundation?
Absolutely, Chris. Go ahead. So,
who's the target membership? Who should join? The SSIs, the commercial SSIs, everybody, community? Where are we?
I think Charlie highlighted it well. What we're finding is, as I pointed out, the whole point of the Trust over IP stack is to support the emergence of digital trust ecosystems. Small ones, large ones, every size. We envision, first tens and then hundreds, thousands, and eventually millions of them, because that reflects what we have in society. So what we're finding is the greatest value is to the stakeholders in those ecosystems. So it's not technology companies, it's not enablers. It is the companies that are defining and building, and governments and NGOs that are building those or need to build those digital trust ecosystems. So Charlie's point about the Good Health Pass collaborative, I think it's over 80 different companies now getting involved there. And they're saying, hey, we need to do this work in defining a governance framework, a trust framework for the Good Health Pass, and they're going to be, partnering with TrustRIP to do that. So if you're building a digital trust ecosystem, or you recognize that you need to do one, especially in healthcare, yes, come to TrustRIP and we'll help you.
And Drummond, if I could just add, and I'd say as I've been also involved with you within the Trust over IP community, we're beginning to see this shift almost within the past 6-9 months to become much more business and use and digital service oriented, right? Where really the innovative both tech and thinking and creating types have been very dominant at the start. I think we're starting to see this groundswell coming of more business-oriented involvement, and that's really where the upper layer stacks of Trust over IP really sing.
That's where the business value is delivered, yep. And that's why, Charlie, you just started a meme here, commercial SSI. It really emphasizes this isn't just about individual empowerment. It is about individual empowerment, but it's about individual empowerment for the commercial benefit, and I would actually say the social benefit too. Governments are hugely interested in this, right? And the fact, as Phil mentioned, World Health Organization has already said, hey, for smart vaccination certificates, SVCs they call them, we're going to develop a trust framework and a governance framework following this model we've been talking about, the diamond. That's going to be, and that's for one certificate in healthcare that needs to be recognized very widely, just like our passports today. So I think we're going to, it's the commercial value and then the social and governmental value that we're now starting to open up.
Yeah,
thanks, Drummond. Thanks, everybody. We are shortly running out of time. It's great to have this trust framework really explored and exploded in today's panel. One thing I would like to add is what Condatis can add to this journey. We have an SSI product set that help codify trust framework, so help with maybe those issuer registries or verifier registries. So we have, for example, an SSI OIDC bridge that doesn't just do the translation to OpenID Connect, but also filtering, allow lists, scoping of and controlling what data is shared. So, and to hear more about the Condatis stack, go to did.condatis.com.
And Chris, I'd just like to say, not that it's a plug, but very honestly, I think what you're doing with this bridge is dealing with a really important problem of, as bridges do, they bring us from one side to another, and in many respects we've got a world that's begun wiring. There's some legacy out there, and I think what Condatis is doing is really helping to bring that forward into these models, trying to make life easier for both issuers and verifiers. So I really applaud what you're doing with that product set.
Thanks, Charlie. So thank you again to today's panel of experts. Thanks to you to give up your time and knowledge and share your knowledge, and arranging all to be in the same time zones as well. So thank you for good morning. For all the attendees, you'll receive an email with a link to a recording of this event, and there's also a link there for a feedback form. So please, if you have time, fill the feedback form. It would be great to understand how useful you found this session. Thanks everybody for today, and good day till the next seminars.